we've been hearing more about whooping cough. We're going to talk about that with Keir. She is with Ohio Northern University, professor of pharmacy practice, director of drug and health information preventive care specialist, and ONU HealthWise, and also with the ONU Rabe College of Pharmacy. So thanks for joining us, Keir.
Thank you for having me.
Okay, so we have been hearing a lot more about whooping cough than we have in the past. So what is it?
So that's a great question. Whooping cough is something that we normally wouldn't see with vaccination. We had pretty much wiped that out. But in recent years, the numbers have increased substantially. Whooping cough is also known as pertussis, and currently we have a major outbreak in the United States, including the state of Ohio. The CDC has reported that we have 6 times higher rate of cases across the country, and we have the highest rate in Ohio since 2010.
Wow. Okay, so first of all, are we just coughing a lot? I mean, why do we have a vaccine to begin with? What are the effects of this?
So it is a bacteria. It kind of starts out just as a cold, the sneezing, runny nose, low-grade fever. And so a lot of times people don't realize then maybe 5 to 7 days later, they may get a more significant cough. And this is a really, really significant cough. They can cough for months and cough so hard they can break ribs, those type of things. But it's very dangerous for our very young infants, less than 2 months old, or one of the highest risks, or individuals whose immune system has been suppressed for whatever reason. Children obviously are the highest risk for complications that can be very serious. And 2 months and less babies are at the highest risk of actually getting severe complications or even dying from whooping cough.
Okay, so we have a vaccine for this?
We do. There's an adult vaccine called Tdap with a T, and then there's also the pediatric form, which starts with a D, or DTaP, and they can start infants at 2 months. They can get another shot at 4 months, 6 months, 15 to 18 months, and then another one at 4 to 6 years. But even as adults, we need to have this vaccine at least every 10 years because it does include tetanus. It includes diphtheria, and it includes pertussis, or the whooping cough, as all combined into one vaccine.
Okay, so it sounds terrible to be coughing that hard where you could hurt your ribs. So what is the treatment if you do happen to get it?
Well, we don't have a whole lot of options other than just managing the symptoms associated with it, controlling the cough, helping with fever, those other aspects. We really don't have very good therapies once you get whooping cough. The only really way is to prevent it, and to prevent it, the best way to do that is vaccine if possible. Plus, we can also give vaccine to pregnant women actually near the end of their pregnancy. That gives them antibodies to help the newborn infant protect them against pertussis, as well as any adults who are going to be around a baby. We also recommend that they get vaccinated as well so that they can kind of protect the baby from developing a serious case of whooping cough. But there's really no great treatment for it. It really is prevention if at all possible.
Does it spread pretty easy? I mean, coughing, I know it just spews it out into the air, so.
Exactly right. It's once those air droplets are out there, and with that coughing and having coughing fits, literally fits, that can spread it very easily.
All right, so we need to take precautions even if we start coughing. All right, so are there long-lasting effects? Like if someone gets whooping cough, can they easily get it again? Or, some effects that last with you for a long time besides having it for a long time?
Yeah, the cough is something that some people may even suffer for a longer period of time, or actually have lung problems long-term because of it. If they get some of the more serious complications, there are seizures associated with it. Some of those can be lifelong complications if they end up getting pertussis. So again, it's rare, but affects more older and younger.
All right, so check with your doctor, make sure you've got the vaccine, or if you need an update, right?
That's correct, absolutely.
All right, wow, some good stuff. We got to get whooping cough out of Ohio. Thank you very much for joining us today, Keir.
Thank you.
All right, don't go away. Noon Edition continues in a moment.